Friends of the media, good morning. Thank you for coming to the press conference on our fight against the epidemic. The Chief Executive say a few words and then she'll take questions from the floor. Please keep your distance in the light of the epidemic. Chief Executive will speak now. Good morning, members of the media and the public. Today, together with the Secretary for Development and Secretary for Security, we are here to give you an account on an important aspect of our fight against the epidemic. Our strategy is early identification, early isolation, and early treatment. So an important aspect is, of course, early isolation. In our fight against communicable diseases, it's important that we isolate those who've been infected so they are taken out of their home and the workplace. That will help to prevent the spread of the disease. This is also an effective tool to cut the transmission chain in the community. Of course, in any places, it's not possible to have completely effective early isolation and early identification and early isolation. That's why we need various social distancing measures to minimize the chance of people coming into contact and being infected. In the past 2 years, we have adopted very stringent public health protection measures. For every infection case, the Center for Health Protection will do contact tracing to identify close contacts. And also we will they will go further to identify close contacts of close contacts, and that's why for close contacts and the secondary close contacts, they have to be isolated when they're found. Now, usually for the infected, even if they have just mild symptoms, they will be sent into isolation center facilities. As for close contacts and secondary close contacts, they are sent to quarantine facilities. Well, whether it's isolation or quarantine, that's based on the law. That's Cap 599A, Prevention and Control of Disease regulation. So we could issue isolation or quarantine orders. Now, if it's a close contact, we issue a quarantine order, and for an infected person, then we issue an isolation order. So whether we arrange for isolation or quarantine, of course, we need to have the facilities and we need manpower to operate these facilities, and that is the focus of our briefing today. Now, the epidemic has been around for about 2 years and so, and we've done much in terms of construction. For the community isolation facilities, we started from scratch. And so we started with nothing. Now we have some isolation facilities, and then we're building even more. Now, I'm sure you are familiar with the Lei Yu Moon Holiday Camp, Foten Chongyang Estate, or Penny's Bay in Lantau Islands. These were isolation facilities that we deployed when we had few cases. Our quarantine and isolation work was done relatively orderly. And for isolation facilities, we focused on the hospital authority, because in the past, when we did not have too many cases, the most cautious approach would be put all infected persons in hospital facilities. And there are some 1,900 first tier and second tier isolation beds in the hospital authority. And then in February last year, the central authorities helped us to build another isolation facilities at Penny's Bay with 820 beds. And then for quarantine facilities, in the early stage of the epidemic, we converted the Lei Yu Moon Holiday Camp, and also we converted phases 1 to 4 of the Penny's Bay facility. So we have a total of 3,700 units. But then in a fifth wave, we're seeing exponential growth in the number of cases, and we have adopted a number of measures in parallel. First, we have triage arrangement. We're also building more, providing more facilities. In terms of triaging, there are several concrete tasks we're doing. Now, for those, apart from those with needs, we allow close contacts to isolate at home. Because before this wave, in the past 2 years, we put close contacts in Penny's Bay for isolation. But then for a month now, we have allowed home isolation for close contacts. We also give them support while in isolation. The second task we're doing is to do triaging for those who've been infected. So some of the infected persons are sent to facilities other than hospitals. Of course, for those in serious condition or with high risk, they should be kept in hospitals for treatment. But then, as you know, with Omicron, there is a special feature. Many who've been infected are either asymptomatic or have only mild symptoms. So that's why we need to triage a large number of people to community isolation facilities. And then hospitals could focus on the infected who have high risk. And then hopefully we could reduce the number of serious cases and death cases. Now, I've given a detailed explanation yesterday on that. Now, to facilitate triaging, the Center for Health Protection prepared an electronic form. We asked people to declare their home own family condition and living condition, so that there could be better triaging. The Security Bureau and the Fire Services Department have also put in place new arrangement for the infected to ask to go to these isolation facilities. And then the Center for Health Protection is also revised the criteria for the completion of quarantine or isolation. Now, if people have had 2 doses of vaccine on day 6 and day 7, if their rapid antigen test results are negative, then they could go back to normal. They'll be out of quarantine or isolation. And then for isolation facilities, there are 5 sources of provision of these facilities. The first type, of course, would be like holiday camps, like the Lei Mun holiday camp. Actually, we've only have 1 camp just now with 352 rooms. And then we could also build new community isolation facilities on vacant sites. Now, all along, we've relied on phases 1 to 4 of the Penny's Bay facilities, which provide 3,400 units. And so when we made a request to the central authorities for assistance, one of the requests was for them to help us build more purpose-built community isolation facilities on vacant sites. And now we have 9 sites. 1 site is at Lok Ma Chau Loop, and 8 sites are at various locations across the territory. In a moment, the Secretary for Development will tell you more. Well, why do I have to, talk about Penny's Bay and the other 8 sites separately? Because for the other 8 sites, the construction model is very similar. But then for the Lok Ma Chau Loop, because it's close to Shenzhen, and we need to enhance our capacity with speed. So the mainland authorities send contractors from mainland to help us build the facilities on that site. And of course, on the same site, there's another emergency hospital being built. And this site provides largest source of units. And after all these 9 sites are actually completed, we would have an additional 50,000 units or so. The third source of supply would be a completed public housing estate without population intake yet. You remember in the early stage of the epidemic, we used the Chunyang estate in Fort Tan as isolation facilities, and then later on we handed those units to those who've been allocated units. And then now we have 3 blocks of public housing estate that will give us 3,400 units for isolation purpose. And then the fourth source of supply would be to pay hotels to use their rooms. you might recall that I had a video conference with the hotel sector. There was positive response from them. Now there are about 30 hotels that would join the community isolation facilities program. About 18 hotels are in operation, half of those who've indicated they wish to do so. And when all 30 hotels are able to provide service, then that should provide us with 15,000 hotel rooms for community isolation purpose. And then the last source of supply would be for us to use 2 large-scale transitional housing projects. There are a total of 2,500 units. And the date of completion is close to when we would need these facilities in this wave of the epidemic. So that's why we'll be using those units for isolation purpose first. And altogether, we will have 20 times more in terms of isolation capacity after all these projects are in place. Now, for the Lei Yi Mun Holiday Camp and the Penny's Bay facilities, as I mentioned, there are about 3,700 units there. So we had 2 sources before, and now we have 5 sources of supply, and all these facilities are completed, and we will have over 70,000 units, all beds. Because in some facilities, the capacity is counted by the number of beds. In a moment, the Secretary for Security will give you an account on the occupancy situation with these isolation units or beds. Finally, I would like to say that we have several hundred times more cases each day than the number of cases in previous peaks. So when we arrange for people to go to isolation facilities or give support to those in home isolation and take care of others in community isolation facilities, of course, there is room for improvement. I and the SL government will continue to work very hard. We hope that after people are infected, they could be put into isolation soon and put their minds at ease. Our assessment is that people can leave 5 days after going into isolation facilities because of the revised criteria for completion of quarantine or isolation. Of course, with any anti-epidemic effort, we need the support of the public. So here we would like to make an appeal to the public. If you have been infected, please follow the risk assessment criteria of the health authorities, or have regard to your own condition. If you believe you need to go into isolation facilities, we would help you go into these facilities in an orderly manner, because that will help to reduce the risk of transmitting the disease to your family members, or for the transmission of the disease in a community leading to another outbreak. Now, I would like to say
完成之後咧，佢哋一共可以提供大約係
size is 8.6 hectare in size, and upon completion, there will be an additional 40,000 beds or units. They will be delivered in 2 phases. For the 6 sites which we are familiar with, including Shantin and Chengyi, they have been delivered and have commenced operation. In Chengyi, the 3,900 beds were delivered on the 1st of March. Like the Chief Executive said, it shows the staunch support from our nation. They were completed in 7 days. For the Shantin side, 2,800 beds were delivered in early March. So the total number provided is some 6,800. In the near future, for Fanlang, the Hong Kong Zhuhai Macau Bridge, Artificial Island, as well as the Hong Shui Kiu, the 3 sites will commence operation. Starting the week, starting 21st of March, the sites at 10 May will also commence operation. It means that in March, there will be an additional 14,000 isolation beds which will be delivered. And let me be more precise. Counting Shantin and Qingyi in March, a total of some 20,000 beds will be delivered from the 6 sites. That is the same. That is Shantin and Qingyi, 6,000 beds, as well as Fanling, Hong Shui Kiu, Tam Mei, and the Hong Kong Zhuhai Macau Bridge, Artificial Island. Altogether, 20,000 beds delivered in March. Further down the road, the Penny's Bay, as well as the Kai Dak former runway precinct, those are major sites. Altogether, 20,000 beds will be delivered in batches in May. And let me share with you some statistics. Like I said, these 6 community isolation facilities delivered in March. At peak, there were 15,000 workers working at the sites. Half of the workers are Hong Kong workers, half from the mainland. The containers were built in the mainland. So we have 7,000 Hong Kong workers and 7,000 mainland workers working together in these projects. At the peak, we have deployed over 620 major construction machineries at the site. At the peaks, every day we have 150 vehicle trips at the site. Later on, we also have marine. We also have vessels delivering construction materials. 6 vessels trips per day at peaks. I would like to express our thanks to the nation's support. I'm grateful for the staunch support from the central people's government, as well as the coordination efforts of the HKMAO. I also thank the China State Construction International Holdings Limited for overcoming difficulties, bringing together Hong Kong workers and mainland workers to work around the clock for these projects. The Hong Kong SAR government will strive to provide the support and coordination in these projects. We believe that with our united efforts, Hong Kong can overcome this fight against the epidemic. Secretary for Security. Thank you, Chief Executive. Members of the public, media friends, good morning. Community isolation facilities are provided for COVID-19 patients with mild or no symptoms to cut a transmission chain in the communities. So far, we have 23 community isolation facilities covering different types of facilities, including a Penny's Bay, isolation hotels, public housing estates, as well as the Qingyi Community Isolation Facility, which was built with the help of the Central People's Government, as well as the Shantin facility, which has been commenced recently. Altogether, 18,800 beds or rooms were provided. As of last night, the occupancy rate has exceeded 40%. In terms of isolation hotels, hotel management is implemented in these facilities. We adopt a human-centric approach to run these facilities. The staff members would communicate with the residents to provide people-based support. And with the support of the national of the nation, the facilities were built up to standard. There are shared bathrooms and toilets. It's like at the AWE to take care of different needs of the residents. We will provide vegetable meals as well as meals suitable for Islamic people, as well as providing thorough disinfection. We are making sure that there is a thorough disinfection for toilets and enough cleansing soaps in toilets. We've also received a lot of support from community stakeholders as well as telecommunication service providers. Special arrangements have been provided for residents. For example, free newspapers, as well as free access to online entertainment platforms, toys for children. There are also 5G network coverage with free local data. We've also received a lot of contribution from the community. We are striving to enhance our service as these centers to offer comfort to the residents. The Security Bureau has been enhancing its speed to arrange for patients to check into these facilities. The FSD has dedicated a hotline to take calls from patients with no or mild symptoms to check into these facilities voluntarily. The response is satisfactory. As of this morning, 19,000 such calls have been received. However, for more than half of the callers, full information was not provided, and also some were not requests to check into facilities, but rather to give us the view. And also 300 are pending. We are receiving thousands of calls each day. To facilitate convenience for infected ethnic minorities, especially a foreign domestic helper, the information package provided by the FSD has been translated into
發出隔離令。
order is issued by the Department of Health to request patients to check into isolation facilities. This is a document carrying legal effect. The public has to follow the order. It is not up to the patients to decide whether to check into the facility. Otherwise, it would be against the law. We will arrange for infected patients to check into isolation facilities as soon as possible. Now, with the ramped up capacity, we hope that we can put more infected persons into isolation facilities to secure the protect the health of others. For those who refuse to be check into the isolation facilities, it would be a public order offence, liable for imprisonment and a fine. If residents have flouted the isolation requirements, they would be liable to a fine of $5,000 and 6 months imprisonment. We will deploy law enforcement agencies to enforce the order. Now, the situation is serious. I appeal to all the public to work with our civil service to fight against the epidemic. Thank you.
Floor is now open to questions. If you want to ask questions, please raise your hand. And when you're asked to ask question, please first identify the agency you represent and then use the microphone to ask your questions. We have many reporters here, so please limit yourself to just 2 questions each. The gentleman in brown at the back. Good morning. I'm from Hong Kong 01. Can you speak up, please? I'm from Hong Kong 01. A number of questions. The first one. The Hong Kong 01 received an open letter by those in charge of the infection control to the chief executive. Now, it said that there are not enough supplies each day. Only 20% of supplies were distributed each day. And they say there is no efficiency in the government and there is no one who could actually lead the whole effort. And different departments are just doing their own things in the prevention and control of the epidemic. So what is the response to that? And yesterday, second question, yesterday, there's an emergency alert issued by the government. Many in the community said that they panicked. And some said it's like a crying wolf is a crying wolf case. And so they just switch off the alerts altogether. So what are the criteria for issuing such alerts, and why did you choose to issue that alert yesterday? The alert was about the Queen Elizabeth Hospital, so why did you choose to send that message as an alert? And for those who have switched off the alert functions on their phones, what would you say to them? Should they turn on the function again so they could continue to receive such messages from the government? Thank you for your 2 questions. I have, read this open letter passed on to me by your agency. Of course, that's an anonymous letter. It said that in the office for the Government Chief Information Officer, there's this distribution of kits against the epidemic. Now, of course, when we design any policies or measures in an emergency, we cannot do so with as much care as we would in normal times. And then we need to do a risk assessment. And if someone needs to go into isolation, we issue an isolation order and that one moves into an isolation center facilities. But if the person is suitable for home isolation, we would like to be able to send him an anti-epidemic pack at the first instance. And there'll be information on our anti-epidemic efforts, for example, their hotlines, if they don't feel well, where the dedicated clinics are located, how they could make appointments, and how they arrange dedicated transport. And we would also give them rapid antigen test kits, and later on we're going to include proprietary Chinese medicine and thermometers and so on. But then we're talking about a huge number. I hope you understand that we're dealing with a huge number of cases. Yesterday, for instance, there are over 50,000 cases, including the self-reported RAT results. And then we're talking about over 50,000 people at home, and we need to send them the packs, and so it's a major exercise. In any case, we are doing our very best. I think it was the day before yesterday we managed to approach